I'd like to welcome Nick Kadash. He's a senior on 6200. He is an expert on restraints, and we just want to go through how you set up restraints on a bed. A couple of our kits are a multitude of different pieces from different kits, so you just have to do trial and error, but he's going to go through each compartment of the restraints. So welcome, Nick.
Hello. So the basic thing we're going to go through first is just the setup if you have time to prep the bed before the patient comes up. With Pinnells, the biggest thing is to use lots of pins, so make sure you bring lots of pins with you. First thing you want to do is get the belt on the bed securely. So when you're applying it to whichever part of the bed or area, because all the beds are different, you want to put it in an area where it won't cut itself, where something isn't sliding, but wherever you can, you can. Push down on the bed mattress to compress it a bit before you put a pin on. That makes it a lot snugger to the bed. You'll still be able to fit some, but it'll prevent movement. The second thing that we don't do often enough that we should do is use the side turn restraints. Lace those in even if you're not using them, right, onto the belt part. Lace them through. As you can see here, we just lace them through and have them ready. Because if you're ready, then you don't have to do it later on both sides. The other item that we use quite frequently, of course, is the beaver tail. Not really any perfect method of putting those together. We usually run it through the webbing, and then you wrap it around and around enough times so that you will connect to the belt up above. This again depends on if you have a new beaver tail or an old one. They're all a little different for their lengths. When you're applying the belt, a big thing too, in case, and just get into the habit, is always put the tab of the belt up. As you can see in this situation, that's what we're going to connect the shoulder restraints onto. So if it's down lower, you can still do it, but it just works a lot better if it's on the top of the belt. Okay. For the shoulder restraints, same thing again. Put one strap across the bed, just a little ways up from the belt. Push down again, pin it securely, and run them through the shoulder restraint pads, approximately, depending upon the height and how tall or whatever your patient is. Again, you want to just get it on so that it's ready. You can always do slight adjustments afterwards.
And make sure those shoulder straps are to the bed and not the mattress.
Right. Yeah, it's not secure if it's not to the bed frame. It just doesn't get wrapped around the mattress itself because they can lift that up. For limb restraints, we have a separate restraint again and a separate pinning again. Never pin to the foot of the bed. Never pin to the head of the bed for limb restraints. Always pin to the bed. And of course, never to the rails because you want to have access to move those up and down and all over. I think that's it for the basic setup. So if you can set this up basically, if you know ahead of time, is huge, saves you lots of time and energy. The big thing again is get that first belt on the bed properly.
I think with all the troubles that we've had trying to find the right pieces for the restraint kits, we are going to separate the kits and put them in labeled bins so that you guys can grab what exactly you need.